Okay, so the topic today is the best medications for Hashimoto's, and I'm assuming that the question is relevant to hormone replacement therapy and for thyroid. Okay, and this is a great question, and I could go on for a long time on this. But I won't. But here's the deal. Okay, I'm considered an alternative healthcare practitioner, and I am functional medicine, functional neurology. And yet even in my world, the research is going more and more towards the earlier you can get the person on hormone replacement therapy, the better. There's a couple of problems there. The person's got Hashimoto's, and they got all kinds of triggers hitting them. Their TSHs can be all over the place. They can have inflammation. It's hard to get the proper numbers to even put that person on hormone replacement therapy. I had a lady in here yesterday, and she was like, yeah, and I go to the doctor and then he gives me the thyroid hormone, and then I get shaky and jittery and all that type of stuff, and then he takes us away, and then I'm down because that doctor really can't. She hasn't even started care yet, and she's got some of the 20 or 30 or 40 triggers that are there. Until you get those triggers under control, it's hard. Really, it's hard to dose thyroid hormone. Now the question is, what's the best one? The answer is, you don't know until you figure out what's the best one for that patient. So I'll give you a couple of real quick examples. I think you just need to get this idea, and this is a challenge. And this is a challenge for me, because if a patient comes in, they have Hashimoto's, they're not on thyroid hormone replacement, it might take 3 or 6 or 9 or 12 months to figure out which is the right one for them. Their doctor might have a hard time figuring that out. And they might hit it the first time and everything's off. So I usually won't have that patient consider getting thyroid hormone replacement therapy until we pull all the triggers, until we, whatever, if it's their gut or if it's stress hormones or whatever thing we have to fix to get the thyroid under control, I'll usually wait. But here's the deal. You go to the doctor and is it natural or is it synthetic? Or is it compounded or is it not compounded? And all of those things can be relevant to what's right for that particular person. Quick examples, okay? A lot of people who come in here who are on Synthroid aren't having a good time. Not all, but a lot. They go like, I've got on a Synthroid, it makes me jittery, it makes me shaky. I think there are still 8 additives to the Synthroid, and one of them happens to be gluten. Maybe they've taken this out since then, but the point is, it just may be that the synthetic Synthroid would actually be okay if there were no sensitivity additives in that capsule. So sensitivities can be an issue. Okay, and then a lot of people take levothyroxine. I take levothyroxine, okay? I take levothyroxine, and I take Cytomel. So levothyroxine is T4. So thyroid hormone comes in 2 different forms. One's T4, one's T3. T3 is the active hormone. Okay, so you have to take that in consideration. Synthroid, T4. Levothyroxine, T3. I'm sorry, levothyroxine, T4. You get to natural stuff like Nature-Throid, Armor, that type of stuff. They're T4 and T3, and I'm not trying to confuse you here, okay? There's a point. And then the Cytomel that I take is T3. So I take a medication that I take in the morning, but I have a celiac. I have other reasons why that medication doesn't convert properly to T3. You have to convert from T4 to T3 for the medication to be effective. Okay, so I have to take extra T3 because I have to take it separately because my body won't take that medication and make it into T3. Now, if your body won't do that, then you need the extra Cytomel. But a lot of you, your T3 is fine. When you do the labs, your T4 is off, but your T3 is fine. Now, if you go to the doctor and the doctor says, oh no, we only use natural, we don't ever use synthetic, and natural is the best. And so we're going to give you Armour thyroid, or we're going to give you Nature thyroid. Well, it's got T3 in it. So now the patient gets T3 and goes crazy. Like they start getting jittery. They start getting, because they have too much T3, and it's making them crazy. So major point. It's not a matter of synthetic versus natural. It's a matter of what's right for you. And so the way it goes is, for a Hashimoto's patient, is, in my world, you have to kind of like, if the person's already on thyroid hormone replacement therapy when they come to me, I'm kind of okay with that. Okay, because as we get the rest of their system under control, you're going to start to see the effects of either too much or too little thyroid on their lab, and you'll be able to send them back to a doctor, and the doctor will be happy to like modulate it. So I'm fine. I don't make people get off of thyroid hormone, because I think in the long run, for most Hashimoto's patients, it's better. Synthetic versus natural is really about, the natural doesn't have any binders in it, doesn't have any things that are going to be allergic. The synthetics can. And so it's a matter of, are you sensitive to those? And then the other thing is, what are your T3 markers when you do your lab tests? And if your T3 is like 130, which is moderate, which is like medium range, if your T3 is 130 and you take Armour thyroid, you might be okay. But if your T3 is like 170, 160, and you take it, you take Armour thyroid, it might just explode you. You'll get anxiety, jittery, heart palpitations, the whole thing. Here's the problem. Most endocrinologists don't know this today. I mean, and I'm not trying to beat it down. It's just stunning. And I know that because I treat these things every day, and I have people come in and I hear the stories, and the doctor is like, oh my God, well, okay, well, we'll try another one. Okay, and now this is why it could take 3 or 6 or 8 or 9 months, because you'll go in, maybe have a reaction, maybe have no reaction, but maybe they can't get it to work because of a variety of different things. Then they'll try another one. But not relative to all these things I'm talking about. It's basically, this is the one the insurance company pays for. If your insurance company's pay for it, it's usually levothyroxine or Synthroid. This is and then you go to the alternative, doctors minded, and they're like, oh no, it's got to be all natural. And so it's, okay, so and each one of them have, the Nature toys seem to be really, really wildly good because of so these natural ones, they have a standard ratio of T4 to T3. They have both, okay. And so if you have that going on and they give it to you and it works great. But if it doesn't, a lot of them don't know why. It's really crazy. And then the last thing is, of course, the T3. So I take T4 and T3. If a person like I have celiac, so celiac people, even if they're doing well, they can have a difficult time breaking down and absorbing things. So and converting their thyroid hormones properly. So your thyroid makes the proper hormone, or you take the proper hormone, but it doesn't get converted properly. So now so then you take some extra T3. I mean, this is thyroid hormone replacement therapy 101, Cliff Notes, in a nutshell. That's all the things that you have to deal with. So I don't know, even if your doctor doesn't know, it'll help you to be aware of this, because then you can start to go, okay, Dr. Rutherford said, like, I took the Synthroid and it blew my brains out, so maybe I need to change to levothyroxine, because that's the other one on my insurance plan. Or maybe you have a naturally inclined doctor, and you'll go like, okay, let me just go straight to trying Armour, and you try Armour, and you feel great. Your T3 was probably low, or you probably weren't converting it and you can tell that by looking at your lab. So I know that's a lot, but I really just wanted you to get the idea. I just wanted you to get the concept of it. It's not about natural versus synthetic. And there are binders in there. You can have sensitivities to certain ones. If you got Hashimoto's, you could be going into your doctor on a day when it looks like they should be giving you less, but actually you're about to morph into something where they should be giving you, I'm sorry, it looks like they should be giving you more thyroid hormone, but you might be on the way to morphing into a situation over the next several hours where they need to give you less, and then they give you more, and you go. So there's a lot of nuances to it. It's not as straightforward as just okay, I'll take this one, see what happens.